in the middle of the lush and prosperous Sundanese area, which is rich of various culture, and natural magnificence. Becoming milestone in educating the nation, building persons to be society servants and nation founders. Universitas Pajajaran, or UNPAD, was born due to the initiation of West Java leaders and government support to establish a higher education institution with various disciplines. Launched by President Sukarno on September 11, 1957, today, UNPAD has a large number of institutional achievements. Such as status improvement as the incorporated higher education with A accreditation. This achievement is in line with the commitment of all policymakers in order to accomplish the vision and mission of UNPAD to be excellent university in conducting a world-class education that is able to support the nation's competitiveness through a quality learning process and innovative research. The representative learning facilities and strategic campus in the center of Bandung City, Bandung Regency, and higher education zone in Jatinangor, Sumedang make UNPAD as an excellent university in conducting education, research, and community services. Through its best programs enabling to fulfill the needs of society. Nowadays, UNPAD has 16 faculties and 1 postgraduate school, totally consisting of 152 study programs. Faculty of Law, Faculty of Economics and Business, Faculty of Medicine, Faculty of Mathematics and Natural Science, Faculty of Agriculture, Faculty of Dentistry, Faculty of Social and Political Sciences, Faculty of Arts, Faculty of Psychology, Faculty of Animal Husbandry, Faculty of Communication, Faculty of Nursing, Faculty of Fishery and Marine, Faculty of Agricultural Industry Engineering, Faculty of Pharmacy, Faculty of Geological Engineering, Postgraduate School. Realizing the importance of learning process, curriculum and learning method are continuously developed in order to adjust the dynamics of stakeholders' needs. Nowadays, UNPAD has used student-centered learning method. That is, learning method focuses on students as the base to actively involve in developing knowledge, skills, attitude and behavior with competence-based curriculum. Supported with professional faculty members and staffs, UNPAD is capable of generating competitive and characterizing graduates. Until now, it has registered 10,000 of students from all over Indonesia and hundreds of international students studying in Universitas Padjadjaran. To optimize the education and learning processes, UNPAD is supported with various representative supporting facilities such as library, Basic Science Service Center, Language Center, e-learning, teaching hospital, and dental hospital. In addition, UNPAD is also equipped with student dormitory, health facility, sport facility, campus transportation, banking, hall, and entrepreneurship facility. Such various facilities are supported with the utilizing of information technology. Besides supporting the academics quality, Universitas Padjadjaran also fully supports the activity of student character building through some student unit. As a part of society, Universitas Padjadjaran absolutely realizes that its function is limited not only in teaching, but also social and cultural aspects. Some social activities, society empowering, and research implementation have been conducted to give real benefits for all society. Universitas Padjadjaran, straightening and developing together with society. From West Java, for Indonesia, to the world through SDGs.
Greetings from Transcendent 2021, massive open online course in Cleft Lip and Palate held by Faculty of Dentistry, Universitas Padjadjaran, collaborating with Smile Train and YPPCBL that has been going on for a few weeks. My name is Shiva Biandra and I'm a student from Faculty of Dentistry, Universitas Padjadjaran. I see that we came from different countries, so I think it's appropriate to say good morning, good afternoon, and good evening to everyone here. Greetings to Dr. Jones Taiwo, medical doctor and consultant pediatric surgeon from Federal Medical Centre, Lokoja, Nigeria. Thank you for being here, doctor. It's been an honor, a pleasure, and we really appreciate your presence here. How are you, doctor?
Good morning, and thank you very much. I do appreciate. And you have a lovely faculty and a very good school. Thank you
so much, doctor. We also have Dr. Hendra Dian Adhita Darsono, consultant endodontics from Universitas Padjadjaran, as our moderator. Thank you so much, Dr. Dita, for being here.
Thank you.
Greetings to all of the participants. Thank you for participating in this course and thank you for attending this live discussion session. So doctor, today is our first live discussion for the 5th week. We are going to discuss COVID-19 and the impact to cleft lip and palate surgeries and about the orthodontic treatments for CLP patients in this 5th week. Today, we are going to discuss about challenges of cleft surgeries in low and middle income countries during the COVID-19 pandemic. This live discussion will be separated into 2 sessions. The first sessions, Dr. Taiwo will be answering the questions that have been filled out by the participants in the MOOC website. The question will be presented on the screen, and the participants have already watched the lecture video about the related topics, which is challenges of cleft surgeries in low and middle income countries during the COVID-19 pandemic. But I think not everyone can make it into this live discussion today, but I'm pretty sure all other 300 participants that have registered into our course will watch the lecture video as well. In the second session, the participants will have the opportunity to ask the questions directly to Dr. Taiwo through the comment section, and the participants can write down the question, their name, and where they were coming from. So the first session, I would like to give the spotlight to Dr. Dita as our moderator and Dr. Jones Taiwo as our speaker. Dr. Dita may start the first session and lead today's live discussion. Thank you so much. We can move on into the first session.
Thank you very much, Shifa. Good day, everybody. Should be good day because some of us is in the morning and some are in the afternoon. So I'm very happy to have Dr. Taiwo here today. And of course, to all the participants that has been through the materials, have already known what is going to be discussed today. And also some of them already put some questions in the platform. And for you, Dr. Taiwo, let me guide the question and read it one by one. And whether you want to answer it one by one or read all of the questions all together and answer it at the end. What do you think?
Well, maybe it would be better to read them one by one so that we can do justice to some of those questions.
All right. Okay. Maybe the organized. Okay, thank you.
Okay. Yeah.
Okay. The topic of today's discussion is the challenge of cleft surgeries in low and middle income countries during the COVID-19 pandemic. And the questions had been put on the platform. The first question, let me read it for you, Doctor. In the lecture, it was stated that one of the challenges during the pandemic was the cancellation of routine clinic consultations and replaced with online media or e-platforms. How effective is it for cleft surgery care? And what about the current situation? Are you still doing that? Thank you. This is from Blandina Sanaraya, Universitas Pajajaran. Thank you.
All right. So, thank you very much, Blandina Chanaraya. I hope I pronounced the name very well.
Yes.
Yeah. Well, the pandemic actually poses a lot of challenges to healthcare and healthcare delivery or service delivery across the world. And like everybody know, it came suddenly when the world was ill prepared for this. Well, different modalities have to be adopted to be able to keep services going while minimizing the effects and the impacts of the pandemic on the healthcare service providers or delivery personnel, so as to safeguard them from getting this disease that may actually cut them off from their routine works. So media platforms were instituted to try to at least maintain something that can keep these babies alive while not operating routinely. As most countries of the world had to divert their health personnel to render services to these victims of pandemics, which necessitated canceling surgery so that beds can be made available for the patients that are more in need of attentions. Most hospitals, in fact, in countries like China had to construct new hospitals. To go to India, you notice that there are no bed spaces available. So you cannot endanger the life of innocent babies, bringing them to a facility that is managing COVID with the attendant risk of getting these diseases. So methods were adapted to be able to attend to them on consultations, at least counsel them using telemedicine to be able to build them up to the nutritional status that is required for them to be able to carry out effective surgery. But in my own country, as at now, we thank God that the effects of the pandemic has wind down and the routine surgeries have commenced since late last year. And I can tell you that we are currently running services full scale. And though there are still situations where there are cases of pandemic managed in dedicated hospitals and dedicated isolation centers, but routine surgeries has resumed and cleft care is optimally being carried out. And I think the same situation arrives in most countries of the world now, except in some places where they are now experiencing the third wave, and that is still putting the life of these innocent babies in danger. But I think things have improved as against how it was last year when the situation was actually gloomy. I hope I've answered the question.
So it seemed that you are not doing the routine surgery.
Now, at the moment, we are doing routine surgery.
Mm-hmm.
At the time this lecture was delivered to WACS last year, cancellations of lists was the routine because of the effect of the pandemic. But right now, in most countries of the world, things have eased down, except few countries like Brazil, like India, and some other countries that are still experiencing the third wave, like the United Kingdom, where routine surgery might still not be holding, especially in places where there's an upsurge in the number, where bed spaces have to be made available, and putting the life of innocent babies who are not at risk, bringing them to hospitals where their parents are exposed, their babies are exposed to the pandemic may cause more injury or more damage. But currently in our situations, things have eased down. We are not experiencing an upsurge in the number. And so routine services have resumed. We now have facial contact with consultations, and then routine surgeries for cleft has resumed since last year.
All right, thank you.
It's about December, January last year. Yeah.
All right, so you have come back to the new normal, isn't it?
New service. New
establishment. Right, thank you, Dr. Taiwo. Maybe we can go to the second question. Thank you for the lecture, Doc. How's the cleft treatment in your area now? It's just explained. Is there any telemedicine? Yeah, it's the same. You have answered it as well.
Yeah.
Or maybe you will add more answer to this question.
The aspect of the telemedicine we use, there are platform software developed for online consultations, and then of course counseling. The patients can go to the local health facility where weight monitoring can be done, and then of course you can interact with the mother periodically to see how the babies are gaining weight. That was what was done then. But like I said, now of course we contact the parents using WhatsApp, using other media. You can put a call through, interact with the mother. If babies are passing through some challenges, you can actually monitor the well-being of the baby as you prepare them ready for surgery, so that when the moment the hospitals are open up for optimal services, then we started rendering surgical interventions. But between that period, we were actually interacting with the patient via telemedicine, using the WhatsApp, using the Instagram and all the other interactive social medias that was available for us to be able to keep care optimal and to keep the babies alive and get them prepared for surgery.
All right, Dr. Taiwo. This is a bit out of the question. If it's the cases are emergency or need to be take an action immediately, do you still do the surgery as well, or postpone it?
No, for cleft, cleft care, cleft surgeries are not.
There's no emergency for cleft care, right?
But for other cases, emergencies, we take those emergencies because those are life-threatening. But for cleft, normally by the Smile Train standard, babies are operated at about 12 weeks when the baby weighs at least 5 kg. So when the newborn babies are born, in my hospital, we have a network of team that babies are referred to us as a major referral center for cleft care. And so immediately a baby is born, our phone members of the team receive phone calls, and then of course I am the team leader, so they communicate across to me, and then we institute therapy as much as possible during the pandemic. A communication is established with the family, and then we can counsel the local healthcare workers as to how to manage the baby pending referral to us. Of course, at 3 months, baby weighs 5 kg. During the pandemic, routine surgery for non-emergency cases were not done. But by January this year, the hospital has opened up, and then surgical intervention for elective cases has commenced. So all those backlog of cases were operated. And now we receive routine consultations, and then we see patients. So there is no more problem as to whether emergency or elective. Now we carry out routine elective, why emergencies were optimal during the pandemic.
All right, thank you, Dr. Taiwo. Maybe we can go to the next question, please. Thank you.
Yeah.
One of the financial challenges in the most low and middle income country is no assurance for the workforce. What about health workers who are at high risk of being exposed to COVID-19 virus?
Yeah, thank you very much. This is a very good question, and it's something that I'm sure your country is a developed country, so it's not comparable to us. In my own country, where even the basic healthcare needs are met out of pockets, outside Cleft, Smile Train sponsored Cleft Care, it's actually difficult for most babies to access surgery because their parents are poor and cannot afford to pay. Now, the same thing is applicable to healthcare workers. There are no routine insurance for anybody. As at today, so many doctors and nurses who lost their life during the pandemic, the government was made to sign an undertaking to insure the life of health workers. But I can tell you that most of the people that died, their families have not received any penny as benefit from the insurance company, which is supposed to encourage them to put in their best in caring for the people that are sick from COVID-19 virus. This is the challenge in my own country. But of course, it's not the same in most developed countries, of which Indonesia is now one. I'm sure the health insurance is better, and the care for the health workforce is also better with good insurance that can make us to risk our life and then take the necessary risks to put the country back on track. But that is not the situation in my country. The risk is there. But of course, we have signed an oath to make sure that the health of our patients are important to us. And so we still do our best within the limit of what is available to protect ourselves, and then to probably take up policies individually so that in case such happen, at least the family will be able to get something from the policy that has been adopted, insurance policies that have been adopted by such a health worker.
Right, Dr. Taiwo. Even though we do, or in other countries have the insurance or whatsoever, the healthcare workers still in the front line and have a very huge risk of being contaminated. Yeah. That's a pity. Yeah.
Yeah, it's a pity.
Right now. Okay, thank you. Maybe we can go to the next question. This is the third and this is the fourth. Due to the condition, will the impacts continue even after the pandemic is over?
Well, I will say yes and no. Yes, in the sense that up to now, the pandemic is not over. We are still battling, and the tendency for us to battle more pandemic in the future is there. What have we learned from the situations that we find ourselves? The COVID-19 pandemic actually brought the world on its feet. And it's proved to us that no country is prepared to actually tackle the major pandemic. So yes, the impact still continue due to the fact that people have become impoverished, the fact that so many health workforce has migrated out of the country. On weekly basis, people are recruited to Saudi Arabia, to UK, to US to meet up their own needs. So in my own country, we are getting depleted in the health workforce. So that means the morale of people that are working are actually gone down. So many colleagues have died, some have become incapacitated as a result of the pandemic, and it seems that the government didn't take adequate care. So people are leaving medical practice to do some other things that can fetch them the needed resources to cater for themselves, while others are taking the next door to exit the country for better claims where they think facilities and infrastructures are there to cater for their needs if they break down and become sick. So yes, it is true that there is an impact and it is continuing. But what we have learned is that we need to actually put some resources together to be able to produce some things locally, where most low and middle income countries depend largely on importations of medical consumables, which were not there during the pandemic because each country is struggling to meet its own needs. We're exposed by not even being able to produce the basic medical needs as simple as latex glove for examining patients, eye shields. Most of these things are imported into our country. So locally, people are beginning to think now that there is a need for such to be internalized, to produce locally, so that in case of a pandemic of this magnitude, at least there will be some resources that can be produced locally to cater for the needs of the people at the time.
That's true. So we have to innovate more and produce more locally.
Car production,
yeah. That's true. Thank you. Maybe the next question or last question in the platform. Many challenges during the pandemic in low and middle income countries. Are there any alternative treatments to decrease mortality of children cleft patients? If so, how it's done?
Yeah, there are really no alternative. You know that cleft is a multidisciplinary approach. And of course, it's a surgical conditions that require surgical interventions. So, but like I said, you see adults. I've personally operated, even though I'm a pediatric surgeon, I've operated a 60-year-old with cleft deformity who has carried it from childhood to adults. And of course, the patient live outside the cosmetic aspect and of the facial deformity and speech. The patient can actually live a good life. People can go to school with it, although there's psychological impact and all those ones. Now, what I'm trying to say is that babies with cleft are not likely to die from the cleft itself. So there is no urgency as to intervening during the pandemic. What needs to be done is to keep the baby optimal. And majority of time, what kills them is nutritional problem, because their parents don't know how to feed the baby. Some of them still breastfeed, even though they know that the baby is not gaining weight. So of course, with telemedicine, we can interact with them, encourage them, show them videos of how to feed the baby by expressing the breast milk and feeding with cup and spoon, and going to the routine primary health care where the number of patients are not so much in their respective community, to get weight monitoring, their routine immunizations, some of which are canceled during the pandemic, to limit movement of people from across the states. But at least we're able to keep most babies alive by encouraging them to feed adequately and monitor the growth of the baby pending the surgical intervention to take care of the cosmetic aspect of the cleft.
Okay, so mortality is not an issue for children with cleft palates.
Yeah, right? The tendency for mortality to increase is there because of nutrition. Yeah. And of course, the fact that the babies are kept at home, the mothers didn't like the situation, there's a delay in interventions. And so it's naturally getting what they needed to get. Even some of the parents who are poor, they can't even feed themselves. So there's a worsening nutritional malnutrition in children, especially those with cleft, who are likely not to get the food that they so need because of competition from their other siblings during the pandemic. So definitely there will definitely be an increase in mortality as a result of the delay in the intervention.
So there's no direct connection between the COVID-19 and the mortality, is it?
Yeah, I think apart from the nutrition, there is really no correlations between the pandemic and the mortality. Yeah.
Okay, thank you, Dr. Taiwo. Is there any more questions in the floor?
No.
Is there more question?
No question there now.
No, okay. I think that's all for the first session. Back to Shifa.
Okay. All right. Thank you, Dr. Dita and Dr. Taiwo, for the great question and answer session. It was very insightful. Next, we will be waiting for questions from the participants in this Zoom meeting. Maybe is there anything you want to tell us, or maybe any advice on overcoming this COVID-19 situation as a low and middle income country, Doctor?
Yeah, thank you very much. You've been fantastic. And like I said before, the impact of the pandemic is an eye-opener to the world, to know that there is no country that is an island on its own. And we need to integrate more and nip every challenges in the bud so that it doesn't become doesn't have a global impact. The world was brought to its knee as a result of the impact of the pandemic, especially diseases that have to do with the respiratory tract that can easily spread. So we need to do more at curtailing cases of diseases that can become a pandemic, so that the world doesn't come to the kind of situation we find ourselves. There are job loss, so many economics crises across the world, and of course the countries that we thought are even big advanced countries, they were brought to their knees. So you can imagine the kind of magnitude, the impact of the pandemic we have on the world. But like currently the situation is getting controlled, and most economics indices has indicated that the economy is improving worldwide, and then the jobs are now being created. People can access job, flights have returned, international flights has returned, and then more opportunities have become available to people now to be able to get their life back. Of course, the impact has been so enormous, because as at currently, the total reported cases is still about 186,638,285 as at yesterday. So it's actually a huge disease. And of course, the death toll has taken about 4,035,037 people as a result of the pandemic. That's actually a very big magnitude. And of course, most of these deaths are recorded in even advanced countries with all the sophistications and facilities that are available for care. So I think the world has come to learn that there's no country that is an island. Of course, what is expected in Africa, for example, is that the pandemic was going to wipe out almost half of the population because of the way it was going. But we thank God that it wasn't like that, because the middle and low-income countries are not really prepared for such a magnitude of disease. Thank God that a lot of research has gone into production of vaccines, which are now being given. I've taken my 2 doses of the AstraZeneca vaccinations, and I hope that that is also done in Indonesia, where most of the health workforce have been vaccinated. In my country, it was a priority to vaccinate the frontliners so as to protect them against the pandemic. And as of June this year, most frontliners have been vaccinated. At least they've completed their 2 doses of vaccines. So I hope in the very nearest future that will be done, and we can get to do with this and review all the lessons we would have learned from this as we prepare for more future occurrences of pandemics that might come, because the world is advancing and researches are on. And of course, we must get prepared for such events in the future, because we cannot completely rule it out that it will happen.
Thank you so much, Doctor. And Dr. Dita, Josefinda raised her hand. May she ask the question directly?
Yes, please.
Okay, Josefinda,
Yes,
you may
please.
unmute your speaker and ask the question directly to Dr. Taiwo.
Okay, thank you very much for the opportunity. Hello, doctor. My name is Finda, Josefinda, from the Faculty of Dentistry, Universitas Pajajaran. I want to ask a question regarding to this topic. So we know that there are new variants of COVID-19, and one of them is Delta variant. And yeah, does this new variant provide new challenges or make existing challenges more difficult to overcome? Or maybe you can tell us how this new variant affects cleft surgery in your country? Thank you.
Well, thank you very much for your brilliant questions. And the good thing about my country is the fact that it's just recently that we are getting some cases of the Delta variant. We've battled, and there are some epicenters, there are states of the federations. My country has 36 states with a population of about 200 million. Although our population is not as massive as your country with 270 million population. But we are lucky that for so many reasons that we cannot explain, the number of patients with tested positive for COVID-19 has not been as high as anticipated. And generally, the country is opening up now because newer cases are dropping, and we think we are getting out of the blue. But of course, the healthcare workers are still advocating and still using telemedicine, TVs, and all the mass media to communicate to people that we are not out of it yet. And so people should not let down their guards regarding wearing of face mask, regarding frequent hand washing, regarding social distancing. So in spite of the fact that most of the health workforce have been vaccinated, we are still not letting down our guard. If you come to my hospital now, you still see displays of notices that you cannot enter this facility without wearing your face mask. Most banking halls, you still cannot enter without wearing face mask and washing your hand, and you still maintain social distances. So I think that should continue until we are able to completely eliminate this, because all of us are still at risk. We've had cases of people who are vaccinated, yet they broke down with COVID-19, especially with the new variant. Now, what we need to be scared about and skeptical about, which should make us not let down our guard, is the fact that this new variant, how sure are we that they will be the vaccines that we have gotten will also be able to provide some immunity against these newer variants of the COVID-19 that we are still battling with. We don't know yet. So I think we still need to continue to maintain all the precautions, especially the preventive measures regarding the preventions of COVID-19, rather than just assuming that because we are vaccinated and the numbers are going down, we can let down our guard and go back to our norms. I think there is a new order in the world now, and we must maintain it for some time until we are sure that we are completely out of the pandemic.
Okay, Finda, is it enough
That
for the
is
answer?
clear. Thank you very much, Doctor, for your answer.
Okay, I hope you are satisfied with my answer.
Great.
Great. Thank you.
Very
All right.
satisfied, Doctor. Thank you very much.
Yeah.
Okay, thank you. I think I can read one question in the chat room.
Okay.
I will read it. In your lecture, it was made political leader. Some countries in Africa believe that the pandemic
is a hoax.
What they're doing is a hoax. So what they're doing to overcome the pandemic?
Well, it's not, unfortunately, thank you very much for the question. It's not just in Africa, it's in Brazil, where the president initially didn't even believe, and quite a number, about 2 health ministers to resign their appointments because the approach of the political leader in Brazil was not favorable to the containment of this pandemic. And of course, in my country too, we experience such. And in some countries like Tanzania too, in Africa, their president, the late president, did also not believe so much in the approach that the WHO is dishing out to prevent the pandemic. Some believe that it is just maybe people are trying to make money, the international, the developed world are trying to force vaccine down people to reduce the population and all those stuff. You know, these are things that are not scientific, but that is politics. And of course, as health workers, we must advocate and make sure that we pass the information across that this is real, and we have managed and seen people who have died from the pandemic, and as such, we must take precaution to protect the populace who are unaware and may fall victim of the political gimmicks and unfortunately lose their life. So we must, as a matter of urgency, continue our advocacy and continue to educate the people and put measures in place to make sure that the vulnerable don't fall victims of the political gimmicks in the world.
All right, thank you. Well, actually, we are now facing the highest peak, even higher than before. So it is not a hoax, I think.
Yeah, it's not. It's a politician.
It's in front of our eyes.
Yeah, it's before us. We have seen it.
Yeah, right. Okay, maybe there are more questions.
I think that was the last question, Doctor.
Thank you.
And which means we have reached to the end of today's live discussion. May I close the session, Doc?
Thank you very much. My pleasure being with you, and it's a pleasure.
Okay.
I do appreciate it.
Okay, thank you. It was a great opportunity opportunity for all of us hearing the valuable knowledge from Dr. Jones Taiwo on this special occasion. And thank you for Dr. Dita for moderating the session. In these hard times of the pandemic, we can still find the bright sides. I believe that this will be an inspiration for all of us to learn about cleft lip and palate more and more, even further to implement the best treatments to our cleft patients, no matter how hard or how big the challenges are. And don't forget to do your precautions every day so that everyone could stay safe and healthy. Thank you so much, everyone, and goodbye.
Goodbye.
Thank
Thank
you.